All right. Hey, welcome back to Arachnoiditis Unfiltered. Today is just like the biggest day for us in our little, what are we, like 32, 33 days into our podcast
Yeah,
now?
something like that. Yep.
And we have landed the goat of neurosurgery. At least she's our goat anyway. Um, we've got Dr. Betsy Grunch, aka LadySpineDoc. She's all over TikTok. She's all over YouTube. She is all over the world with her neurosurgical skills and being on stage talking about all the things that she can do. And today we have the privilege to have her, and especially during this month of Arachnoiditis Awareness Month. This is a special privilege for us because what initially drew us to you, Dr. Grunch, and can I call you Betsy? Is that okay?
That's fine, yeah.
Thank you. Okay, because I love that name, by the way. So, what drew you to, well, I know what drew you to neurosurgery, but what drew you to do the arachnoiditis short that you did? Because that was the best explanation of arachnoiditis that any of us have ever seen. And we
Yeah.
chimed in
Yeah.
on our arachnoiditis groups. Um, what, what led you to do that?
I mean, like my whole platform is taking a topic and trying to break it down in terms that anyone can understand. So I do that with many different disease processes, and I always try to find like something new to talk about. So arachnoiditis is something that affects many people, affects many of my patients, and not a lot of people understand. So it was just something that I wanted to kind of break down and explain. And I like making videos that I could also like refer my patients to. So if
Yeah.
they, maybe don't, or my patients can take and then send to their family members because maybe they can't take what we said in the clinic and go explain it to so and so. So I'll send them that or refer them to those types of educational stuff that I do.
Yeah, that's
So,
awesome.
Sarah and I are both medical professionals. Sarah was an RN for nearly 20 years. I was an X-ray tech. I would love to be in your OR running a C-arm or doing navigation, which begs the question because I'm an old medical device sales rep. I sold for GE, OEC. What kind of C-arm do you use? This is for me personally.
Well, we use GE,
Of
so
course. Yeah.
yeah, and we have a 3D arm. I don't use
Okay.
it that much, but it's
Siemens,
also nice.
probably.
What is that?
A Siemens.
Ah, I think it is, but I'm not 100% sure. It's been a while since I've used it, but
Yeah.
yeah, I mean, I usually whenever I'm using not, I mean, I use fluoro all the time too, but whenever I'm using intraoperative imaging, we use the Arrow, um, but it's now purchased by Stryker, but it's an intraoperative CT. It's
Oh
nice.
yeah, yeah, yeah. There was another company, man, I forget the name of it. That had a mobile CT, and much like you and much like myself, we both got into the medical field because of a trauma that we suffered. Your mother suffered a trauma. I suffered a trauma, which led me to it. And the guy that did the mobile CT for the OR was motivated because his brother needed an intraoperative CT, couldn't get
Mm.
it because the technology wasn't there, and he died as a result. And this guy was motivated to basically start a medical company from zero and
Wow.
really do well with it. Yeah. So um, anyway, hey, I I saw or we heard that your son had surgery, right? How's
Yes.
everything? How did everything go? We want to make sure that everything's okay.
Oh yeah, he's good. He just had a oral surgery done. He's 10 and his teeth hadn't erupted yet, so he had to go and get some
Oh.
gums removed. It was something, but we're on the mend, I
Okay,
think.
good. Yeah, I saw that video. I never developed molars. I was like I'm like a medical enigma with everything that I've been through. Trust me. I could,
I thought that was what was happening to him. I was
oh,
like,
really? Unfortunately not, but there you go. Sarah, what do you have?
Okay, so one question I just want to ask, kind of offhand, about arachnoiditis specifically. Um, well, when did you originally hear the term arachnoiditis? Was it in med school? Was it with your patients?
oh,
Do you remember?
probably in residency, to be honest. Like arachnoiditis is something that, um, sometimes can be a little tricky to diagnose, but it can be a complication of surgery. But I don't think in medical, they don't necessarily teach us that in medical school. So I learned it in my training.
As
And
a
I think that's something
neurosurgeon?
that a lot of healthcare professionals don't understand. Even physicians don't really understand
Yeah.
is what is it, and you know, why does it do what it do, and
Hmm.
those
Yeah.
kinds of
All that
things.
stuff. Yeah.
Do you think
Do
it's
you think it's,
misdiagnosed? That,
Yeah,
it underdiagnosed as well?
yeah, that was my next question. Yeah. Like
yeah. I mean, it can happen anywhere in the spine, but when it's obvious, it's pretty easy to diagnose. If you have someone with
empty sac.
yeah, empty
Yeah.
sac, nerves are all plaster to the side. I
Hmm.
mean, usually that's not missed by radiology. It's pretty evident. But you might have some, arachnoiditis. It might be fairly um, difficult to see on imaging or be at a different level other than the lower lumbar. Those can be a little tricky. And, even surgeons can misdiagnose it if they've never seen it before, never had a patient with it. So, yeah, this can be tough.
Yeah. So in my case, I was diagnosed in 2019. I was misdiagnosed for, a decade because it probably was early stages and then progressed to empty sac. But just recently I
Mm.
had a repeat MRI because I went into this really bad flare. So I thought I had like a CSF leak or tethering or something. But a neuroradiologist at my local hospital, which is a big hospital system, read it as not arachnoiditis. So now I have that in my chart, and I don't like that because I'm on disability. You know what I mean? And it
Hmm.
sets up, a stance for
What was
moving
the cause
forward.
of yours?
Um, well, I had a traumatic C-section for my one and
Mhm.
only child. They stuck me 8 times. I don't know if that was the insult that did it or because I was in pain before I even had him, like right
Yeah.
at that moment. So what happened is my pelvic shifted, and I have a very rare anatomical, variations. I have bifid sciatics with the piriformis, so I'm like scissoring every time I, walk.
Oh gosh.
And then I
Yeah.
have cojoin nerve roots L4 to S3, so
Hmm.
pudendal issues, like all of that. So I think it's kind of inflammation is going up channel, if you
Yeah.
will.
It's
So
tough.
yeah. So
So, what's the one question that patients don't ask about arachnoiditis that you wish they would or you wish they knew with respect to the disease?
I don't think patients, I mean, if I don't even think most patients know what it is. Even
No.
if I tell them they have it, they don't really understand. And I
right.
think that's, the biggest thing. It's difficult. And it's difficult for most people to even explain to people what it is.
Yeah.
So it's really important, I think, to continue to talk about it and educate about it because maybe more and more people will hear and understand that it's not like, you know, just an issue that's there for a minute, it's going to go away. Or like in your case, it's missed on a read and then
Mm.
you just don't have it anymore. It's a progressive thing.
Right.
And there's so many conditions in neuroscience in our field that get misdiagnosed or gaslit, I guess. And it's very difficult because it leads to, I feel like a progression of someone's mental health when they're not appreciated or they don't understand their diagnosis. I saw a patient earlier this week that um, my staff was like, "Ooh, you're gonna have a hard time in there. She's not very nice. She's very
Mm.
aggressive." And I was like, "Okay, whew, I'm getting ready," like, "Oh, here we go." And
Right.
I was her like eighth opinion, and it wasn't for
Wow.
arachnoiditis; it was for something else. And I get in there and, well, she's all like this, just really
Mm.
like ready to go, and I start talking to her and just break her down a little bit. And it's just, she's just so standoffish because she's just been blown off for so many years because her pathology wasn't read correctly. I mean, it's minor, but, and I told her, I was like, this isn't operative. And she's like, I'm not looking for an operation. I'm just looking for answers. I just want to
Answers.
know.
Right. Right.
Hmm.
I just want to know. I just want to, and that's a lot of people. I mean, and I came out and gave her, left. She left, and my PAs were and my MAs were kind of at the front desk, and they saw like I was smiling when she came out. She was smiling. They were like, "What happened to there?" And I was
Right.
like, she just wanted to answer. Sometimes people just want to be validated and understand their body.
Well,
That's it.
I would think being in the room with you, you could pretty much subdue any irrational person
Right.
just with your, I mean, you've got such a presence, especially on the internet, obviously. Um, did that come as a surprise to you when things just kind of took off for you? And how, what was the point where you went from just doing it for your own fun to now it's become kind of a second job for you, right?
Oh, it is a second
Yeah.
job,
Yeah.
100%. It never stops. No, and it's fun. Like, I don't, so I try to explain to people it's like not something that I'm doing because I have to. It's something I really, really enjoy. And it's brought me like this. And being in the healthcare profession, you guys are both there. It drains you, man. It just gets
Mm,
to the point where you're just like, why am I doing this?
right.
So I'm able to take, like, I feel like what feel empty about in healthcare and can bring it to the camera and just, talk about things. And it makes me have this dopamine that sometimes you just don't get. And it didn't start out that way. I would say, like, I don't feel like I mean, I don't know, my early content wasn't great, but I think just as, and I tell people that want to do content creation this too. They're like, oh, I just can't do it. I can't explain things like you do. I just hate hearing the sound of my voice. I was like, bro, if you listen to my stuff in
Right.
2020, it's so cringe. Like, you don't walk into the OR and know how to be a surgeon. You start as a medical student, a
Right.
resident. You
Yes.
learn and you
Yeah.
kind of like train, yourself how to be better each day. And so I think I've been doing this for 5 years. So, like, just understanding like how people portray what I say and then know how to do it better. Like, each time I read my own comments, I try to reply because sometimes I'll say things that maybe be taken the wrong way. So I've become a better communicator over social because of my growth. And the same thing as a physician, I feel like social has made me a better physician because I know,
Yeah.
like, where else are you going to be able to say something and have 10,000, a million opinions instantly?
Right.
Yeah.
Right. Right.
Good, bad, and indifferent. I mean,
Oh yeah.
we've been doing this for 30 some days and we've had our haters already. And our point, we try to bring levity into a very dark disease and
Yeah.
painful situation. I always find a reason to laugh and make
Yeah.
people laugh. I was always kind of the class clown, so that was my thing. And I bring that to this disease now. And we get people that say, how can you laugh with,
Or how are we smiling? Or,
exactly.
we're in
And I'm like,
pain, but it's still
it's a
mindset.
choice. We always say it's a choice, right?
Not that we don't have our bad days, of course.
Yeah.
Yeah. I mean, I think people just have a misperception of chronic pain
Hmm.
and like,
Yeah.
oh, if you're in chronic pain, you must be miserable all the time. No, it's like a mindset. I mean, yeah, you can live in pain and still portray yourself a certain way. You can't just be miserable forever. And that's a misconception of everybody, not just the healthcare profession, but of the general population, that if you look good, you must be good. And
Thank
that's
you.
Right.
not
Yeah.
Thank
necessarily,
you.
yeah,
Right.
it's a
Right.
problem.
I look good 24/7. So people got to be thinking,
Right.
what's going on with you, Steve?
And no one would know that you just,
Yeah,
you
I
just
mean,
roll.
to look at this from this point up, but
Yeah.
to see me with my forearm crutches and, my, uh, I'm not so fleet of foot anymore. Um, it's pretty obvious when I park in the handicap spot that I need the handicap spot,
Yeah.
especially when I use a wheelchair. But yeah, the whole, well, you look so good. That's like almost the most offensive thing that somebody could say to somebody like us, but that has the invisible disease, right? Because you can't
Yeah.
always tell. Um, so yeah, and
And
we
that's
have
the other
three.
thing. Like, they call it an invisible disease, but I mean, it can be seen on an MRI to a right trained eye, right?
Yeah.
That is another big thing. Like, I don't know. Do you feel like it's misdiagnosed on a mass scale, or do you think it's still a very rare disease?
I think it's misdiagnosed just because most people maybe don't even know it exists.
Right.
Right.
Like, even radiologists, they may
Right.
not. I mean, you're a neuroradiologist, you should know because neuroradiologists are trained. But let's be
Right.
honest, not everybody is out in downtown Chicago getting their MRI at the most elite medical center with all the
Right.
latest and greatest radiologists. Most people are up in their own little city, and
Right.
radiologist is generally trained. Maybe he's been out in practice for 20 years and has never seen a case of arachnoiditis. He forgot about it or whatever the
Sure.
case may
And
be.
I think too, they just look for like certain, the bigger things like stroke, or obviously not in your back, but you know what I mean? They're looking for like big tumors or something.
Yeah, certain
Crazy.
things are going to stand out on a CT and an MR.
Right.
MR.
Yeah.
But yeah, I think it comes down to, what are the symptoms that going into the diagnosis or to the rule out type situation with an MRI. Mine was incontinence, loss of feeling, loss of balance, I lost feeling in the saddle region. That's because I have CES as well, cardiac equine syndrome.
Mm-hmm.
Great combination, by the way. Just lovely. That's like the lottery of shit you can deal with. Trust me. So how many cases have you seen in your career? Because I've asked this now since I was diagnosed initially with my my neurologist, who actually came in, and this was the most compassionate thing that I've ever felt from a physician. He came in and he was reading me the results of my MRI, and he hung his head and he just shook it side to side and he said, "I'm so sorry." And I was like, "Oh my God, what am I in for?" And he says, "You have this disease called arachnoiditis. It's incurable. It's very painful. It's more than likely going to be progressive. And you're just basically in for a life of pain." And I mean, that made me feel for him because I saw his compassion. And then I asked him, I was like, "How many cases have you seen?" He's like, "I've seen 3 in my career." And this guy was in his 40s. So he'd been around the block a few times. How many cases have crossed your threshold?
I mean, I don't know. I've probably seen, maybe 30 or 40.
Wow.
That's
I
pretty
mean, that's
significant
pretty
number.
significant compared to a lot that I've been to.
I
Yeah.
bet there's probably more that I missed. Who knows?
Right. Like early. It's really hard, I think, to see the early unless like you're Dr. Tennant, right? And you're looking at them all day, every day for
Yeah,
that specific disease. You know what I mean? So,
yeah.
So
And
when
now,
you,
I mean, probably even more so too. So
yeah,
I don't know.
yeah.
That's just off the top of my head, but I think I'm starting
Right.
to get some patients that come and see me for opinions because they've not had answers, and so I'm a little
Yeah.
probably,
It's probably going to
well,
up now,
yeah.
right? Yeah.
the sad thing is, and I told my mom this, who suffered a trauma, when you get a diagnosis, you can take that and $1 and go buy a Coke, because really, what does that get you? It gets you confirmation, but it also gets you in a line of people that are, going to look for answers the rest of their life, going to look for a cure the rest of their life. That's kind of what Sara and I are trying to do, is push for a cure, push to get in front of Congress for more treatment options, for more money to go to studies, because we feel it is underdiagnosed. We also feel like epidurals are a big part of this, because we know so many young mothers that have had children, had epis, and then shortly
Right.
thereafter birth, yeah, Sarah's one, have developed this disease. And as tough as raising kids is, being healthy, raising them in constant pain and chronic pain has got to be the worst nightmare of your life, because this is the best time of your life with a child, right? You get to watch them grow up. And I was a dad that had to sit on the sidelines with my disease. I was a dad that missed Christmas. I missed holidays, trips, because I couldn't sit in a car. I couldn't go anywhere. And that's kind of the sad thing. So we're really pushing for a change. We're pushing for a cure. We want to get in front of Congress and talk to them about this. But we need, other people leading the way, like you, with, your description of
Just put
arachnoiditis,
that
but
on
also
you right there.
after this, amongst our group, you're going to be the go-to. I'm sorry if your office gets flooded with calls. We hope that's
He's
the
like,
case
damn it. What are
in a
you
good
doing
way.
to
Yeah.
me,
Yeah.
Steve?
Yeah,
Not that
I've
we,
actually, I mean, social media has been amazing, but it is challenging. Like I'm only one person, and my dedication is to excellent patient care. And I actually had to kind of like at one point last year, I had to like completely stop taking new patients because I just feel like it's so challenging for me to deal with.
Right.
I can't take care of the world, so I do my best, but yeah, like I now I just have to limit it to people in my region. I'm so sorry.
So do
But
you
it's
do
just because
like
it's so
phone
hard.
consults or anything?
What is that?
Do you do like a phone consult or telehealth? Like as in
Yeah. So funny
my
thing about
condition.
telehealth is you
Yeah.
actually have to have a medical license in the state that the patient's in. So I'm
Oh,
medical license in the state of Georgia. So unless you live in Georgia, I can't provide legally, there are people that do it. And I guess you could go and get medical licenses in
Yeah.
every state in the United States. But like if you're in North Carolina and I'm in Georgia, I can't provide you. I'm not licensed in North Carolina, so I would be committing a crime.
That is, yeah, not a
Yeah,
good thing.
so
Right.
Don't want to go there.
Right. Yeah.
no, I don't look good in
Uh,
orange. Maybe I do look good in orange, but I don't want to wear it.
Right. You don't want to do that.
yeah.
No.
So once you have diagnosed somebody with arachnoiditis, what's the process after that? Are you treating them? How do you treat them, or where do you send them after the fact?
I mean, I guess it depends on what's going on. I mean, we know that there's not a surgical cure necessarily. I mean, in terms of like, I can't go in there and break up all the adhesions.
Right. Yeah.
Sometimes it can be surgical if there is like tethering or something like that. That is depends on, it's a case by case basis. Often, I'll refer them to pain management so we can work on a medication regimen. I'll start some meds to try to jump the process, but I do get involved whenever it escalates to the point of maybe neuromodulation or spinal cord stimulation, intrathecal drug management or something like that. But yeah, I mean, mostly I tend to refer people out to someone I know that understands the disease.
Yeah. So has there been any? I know you had at least one patient that had success with the spinal cord stimulator, but in the ones you've sent, have they all been successful?
I mean, no.
Managing some pain. Yeah.
I would be lying to say that every patient that has a spinal cord stimulator is successful. That's
right.
Just like saying every surgery I did is a success. No, I mean, it really is important to understand where, you can get benefit from these treatments and where you can't. It's important to do trials and making sure, and then sometimes you'll get it and you get a different result in the trial too, which can be frustrating. I have a patient that I'm managing cauda equina syndrome, arachnoiditis, years ago diagnosed, and I've been begging him to try his trial, and he got a trial and it worked. But the leads pulled and he's like, all right, I'm desperate. I don't know what else to do. Let's just do the trial. And I was like, I don't know let's do the perm. But anyway, long story short is he got the perm and then the battery started hurting. And then he's like, just take it out. I'm done. I don't want it in there anymore. I was like, well, let's just try to move the battery one more time. And then it's like, no, just take it out. So I had him scheduled for the removal. And then he thought about it. He let me just move the battery, and it's been very helpful for him. He couldn't get over the battery site pain, and anyway. Yeah. So it's definitely challenging.
Sara just had a ketamine infusion. She went through a series of ketamine infusions, and of course, Medicare does not pay. We're both on Medicare because we're both disabled. They don't pay for ketamine infusions because it's off label. Go figure, that's their way of getting out of it. But it's a measure of last resort for people like me, because I'm the rare anomaly that I don't take opioids. I was on every imaginable drug before, gabapentin, gabapentin is Neurontin. Just you go down the list, I was on it, and none of it did anything for me. In fact, this past weekend when I was in the heart hospital having a heart attack with my chest pain, they gave me morphine. It helped my chest pain. It did nothing for the pain that I have in my foot due to arachnoiditis. So opioids, for some people, much like myself, don't work. We just kind of have to suffer through it. But we want to get in front of Congress and lobby for a ketamine infusion. Would you be willing to go before Congress and advocate for something like that for people like us that are at a measure of last resort? I'm not asking you to,
yeah, you don't have to answer that now. Maybe take some
with your influence, I think that would it would carry a lot of weight for people like us, and to influence people, that basically set the laws that restrict how much we can have, what we can have, and when we can have it.
Well, I think the big take in your situation too, Steve, is like you've exhausted every other resource, right? It's not like you just want to go straight to ketamine. You've done everything you can do. Procedures, meds. Yeah.
No, I'm a big lobbyist for the right treatment options for patients, whether it be this or a surgical device that's whatever so many different things that are out there that unfortunately in our great healthcare. I mean, it is a good healthcare system. I don't want to
Yeah.
like play it off
Bash.
like
Right.
we're not in a good situation. I think that we have pros and we have cons, but unfortunately, like coverage sometimes is a big issue for these types of treatments. And I think so much of it is because of overutilization. I mean, it's not coming from a bad place per se, but it can be quite challenging when you have patients that really need something that don't have the access.
Yeah.
And that's, one of the things that I enjoy doing with my platform is whenever I do have a big voice, I can, put it where my passion is. So,
Yeah, that's
Well,
awesome.
we would love for you to advocate for us if you're so willing. Add that to your schedule, right? I
Just
gotta ask
another
you
million things for
because
you to do. Right.
with my pain, the toughest part for me is sleep. Standing is least pain, sitting more pain, laying down is excruciating pain. So sleep is a precious commodity. I probably get as much sleep as a third year resident. I mean, literally just
mm-hmm.
4 hours. Sarah knows.
Yeah.
Um,
Yeah,
how do
we're
you do it?
opposite. I can
Because
sleep for days. He's
yeah,
like
I
never
mean,
sleep.
I think on average when I have a flare up, I'm up for roughly 72 hours, and then
Oh my
my
gosh.
body just gives up and it crashes. But all I
Yeah.
need is 8 hours.
Yeah.
How do you do it? Like you're 24/7 with everything you do. How is it you manage your sleep at all?
I mean, I like to talk about everyone getting proper sleep, but I don't do it. I think in residency and at surgeons, just in general, I'm so like when I'm on call, I get an hour, woke up, 30 minutes, woke up, so,
Mhm.
and that's several times per week that I'm on call. And sometimes if I'm on a weekend shift, it's 72 hours straight. So, and then as residents, obviously I didn't train during the 80-hour work week. So I trained for 6 years of my life without, sometimes working 120, 30 hours a week. So I'm
Oh,
used to
wow.
surviving on no sleep, but it's not good for you.
Yeah.
But
Right.
that being said, I mean, I don't know, I can sleep for like 5 or 6 hours, and that's pretty much all I need. Now, last night I got, let's see, got about 9 hours, and it was glorious, and my body
Whoop,
needed it.
whoop. Right.
That's like
Take that.
you're going to
That's
feel
awesome.
great in a couple of hours, I'm sure.
I know, I'm gonna feel like I'm on top of the world.
Uh, I will. I'll officially make you an unofficial arachnoiditis patient due to your lack of sleep because that's really one of our biggest
Oh,
complaints. It's really because sleeping is healing, right? And we need
yeah.
healing with the inflammatory process that we go through every single day. When our body is at rest, I guess it's trying to do its best to heal us, but sometimes we wake up in worse pain, after a great day. I mean, that's just kind of the up and down cycle of arachnoiditis. But
Hmm.
so, what do you plan with your social media presence? Are you just going to continue to grow it? And is there any point where it would be so big that you would do that full time versus being a neurosurgeon because of the stress,
Oh
lack of
gosh.
sleep, and the pull? I know, right? This is a question you have to answer at some point because you can
Yeah.
get
No,
very,
I
very
mean,
busy.
like it would be funny to be a neurosurgeon on social media and not practice neurosurgery. I feel like that would make me not
Yeah.
representative of who I am.
That would
And
make you
obviously,
Dr. Oz, in other words, right?
yeah,
Yeah.
yeah. So I don't have any plans of stopping clinical medicine because it is like what I do and
Yeah.
why I do what I do. I have like, a little bit like scaled back some of what I do clinically just to have the bandwidth of doing what I do online. And that's kind of neat because it gives me the ability to spend more time with my family and stress. I mean, it's, I mean, social media is stressful also, but not in the same way.
It's a good
So,
outlet, though, right?
yeah, I mean, I just kind of plan on doing what I'm doing now, which is like, work 4 to 5 days a week and then do social media
Yeah.
24/7.
Right. Fill it in
Well,
all the other time you have. Damn, girl.
we're-
Oh,
I know we're
that's
probably glad to hear that you're going to keep doing this because
yeah.
Sarah and I often talk about how much we miss the patient contact. Being out
Yeah.
there, making a difference, making an impact in the world versus just sitting in the four walls of our house and
Yeah.
basically
Yeah.
being in misery. This is kind of our new outlet, trying to make a difference here, and again, we appreciate you being on. I know we're getting short on time here. Sara, do you have any last things for Dr.
No,
Grunch?
I think we really pretty much covered everything. I mean,
okay.
And I know she's tight on time, so
I will have to say that you're the most relatable, down to earth neurosurgeon, and I've come across many. I mean, I spent my entire career in the OR, and I appreciate that. So the last question I have for you: what's on your OR playlist?
Oh, it depends on my mood and depends on my day, but most of the time I love hip hop and
Okay.
rap. So I usually listen to female rap like Glorilla, Megan Thee Stallion, Cardi B. That's like
All
my
right.
vibe. Sometimes it's a little like I just need some like, relaxation. Turn on today's hit, maybe a little Sabrina Carpenter or something like that.
Okay. Yeah, I've heard some really eclectic music from a lot of different people in the OR.
Yeah, there's a couple neurosurgeons at my hospital. They listen to house, EDM, and it's like a club in there.
Yeah.
Is there anybody singing in the OR while you're operating at all with your music?
I think it depends on the vibe of the room.
Okay, yeah, I would agree with that. Yeah, because you can go into some where it's like it's hush hush and it's very serious and it's all focus
There's
versus
another surgeon that is everything is quiet. Yeah.
so. Well, I appreciate you for getting into medicine for the reason that you did. You know, when you're called to do something and you have a passion for it, it's effortless. And it's what's the old term that says if you do something you love, you'll never work a day in your life.
Yeah.
You're working hard, but I know you love it, and we love you for it. Thank you so much for coming on. We'd love to have you back at some point if you're open to it. And if we ever do get the opportunity to go to Congress, I'm going to send you an email, and I'll look for a reply, and I'll keep an open seat.
We're reeling them all in, anybody we can get. Right?
Love it.
All right. Thank you so much, Dr. Grunch. Hey, everybody, this was the best episode yet. Tune in for more. We've got other stuff coming up. We look forward to watching things grow and adding people onto our little humble podcast here. Thank you.
Yeah, and we'll add her info below. So
yeah, it'll all be
if
in there.
anybody's in Georgia, they can,